It's 3 o'clock. We're approaching the end of a fantastic conference, but before we let you go, we're going to discuss the topic of patient safety here today. For those of you I haven't met, my name is Thomas Straumitz. I'm a pharmacist by training, spent almost all of my career in big pharma around the world, but since a couple of years back I'm working for EY in health and life sciences. I'm based here in Stockholm. Patient safety is the focus of the session that we have ahead of us. And yes, that is a critically important topic because there is so much going on in healthcare. We're switching patients out of hospitals sooner. We're redesigning patient care pathways. We have artificial intelligence on the way in. There could be an over-reliance on what the systems tell us, etc. So we need to ensure that patient safety is really baked into the center of all these processes as we design new care ways. I'm thrilled to have a great panel and some great speakers here with me today. And I'm going to ask our first speaker, Andersson Ödman, Assistant CEO of the Blood and Tumour Diseases in Akademiska Hospital Uppsala, to give us the first talk. Go ahead.
Thank you. My name is Andersson Ödman, Project Manager at the Hematology and Oncology Department at Uppsala University Hospital. And I will try in a very short time to give a brief introduction to a project that we've been carrying out in the Uppsala. And I think it's perhaps lucky that I'm a Formula One fan, because I will probably do this in Formula One speed. See if this is working. Well, as you know, the number of patients, cancer patients, is increasing constantly. And national statistics show that by 2040, there will be around 40% more patients with cancer compared to today, which is perhaps not a very encouraging thought. But we also know that due to better and also earlier diagnostics, and thanks to the enormous development of pharmaceutical products, patients are living longer with their cancer today compared to maybe 20 years ago. And the new pharmaceuticals are more often than not much milder, and patients tolerate these pharmaceuticals much better than earlier, which means that we are it makes it possible for us to treat older patients. So, combination of this, the number of patients that we in the healthcare sector needs to provide care for is constantly increasing. And our resources are still limited. We have to find new ways. And I can just say, as an example, we moved our entire clinic to a new building in 2020, and already from the beginning we were crammed, especially in the outpatient departments. And the number of treatments that we have been giving since 2020 in those two outpatient departments have increased by more than 40% in just 5 years. That's a lot. Another thing that we have to consider is that when patients are living longer with their cancer, their demands of treatments not intruding into their everyday life are increasing, and they would like to have the care on their own terms, and rightly so, I would say. So there is a lot of demands on us. We had to do something in order to provide care for all these patients, and also give the patients the best possible care and the highest possible quality of life. So what did we do? Well, we teamed up with patients' organizations and also several companies from the pharma industry. And to make a very long story short, this ended up in the Gränby Clinic. The Gränby Clinic is a small treatment clinic located in a shopping mall in the outskirts of Uppsala, where patients can go to get their cancer treatments. The results from this clinic shows that patients are very satisfied. They appreciate the easy accessibility, the more home-like and calmer environment in this small clinic, and also the possibility to carry out errands in the mall while receiving their treatment. And staff satisfaction also very high, and maybe most important for a lot of our politicians, the cost per treatment is almost 50% of the cost in the hospital. And so we are continuing on this way to moving the cancer care closer to the patients, and by 4 key activities. We just 3 weeks ago, we started a new clinic in Tierp, a small village in the northern part of Region Uppsala, in order to allow patients not to have to travel all the way down to Uppsala to get their treatment. We are letting people, patients, self-administrate their subcutaneous cancer injections by themselves. We have initiated a collaboration with the primary care in order to allow patients to receive treatments in the healthcare centers instead for in the hospital. And we're also increasing the possibility to use a mobile unit to go out to patients not having difficulties coming to us. Just a few words on why I think this has been such a success for us, at least. And I think I can say collaboration and courage. Hospital staff, together with the pharma industry and patient representatives, we have worked and are still working in a very non-prestigious project group. We're sharing freely the knowledge, the competence, the ideas, and the contacts that have made this possible. And I would say this is the key. None of us would have been able to do this by ourselves. We need to collaborate, and we need to collaborate between the health sector, the industry, but also with the politicians. And perhaps I also should mention that we always been supported by our hospital management, but also by the political region management in Uppsala. Thank you. I almost managed on time.
Wonderful.
Yeah.
Thank you very much, Maria. Maybe just one question. So moving care from a hospital to a mall, I'm sure that raised a lot of concerns around, patient safety.
Yes.
What would you say was the single largest patient safety issue that were raised when you suddenly said, yes, we're going to move to Gränby?
I think most questions came from the staff, actually. The patients, they wanted this. But of course, it has to be done in a patient-safe way. So all patients are receiving their first 2 treatments at the hospital before they are allowed to move out to this new clinic. We have arranged with the SOS alarm, so they know where we are in case of anything would happen. Some of these treatments are still rather harsh and comes with a lot of side effects, and those treatments we do not move out. They're still in the hospital. But so far we've been working in Gränby for 2 years, and we have had, let's say, 2, maybe 3 not so acute reactions. So I think there's
So selected patients, selected treatments, and in a
yes,
safe
yeah.
sort of setting of transitioning over.
Yes, and just
Great.
in case, we also have a physician in place.
Yeah. Very good. We'll come back to you in the panel, but thank you very much for now.
Thank you.
And I would like to welcome Lena Coulibaly up here on stage, Public Affairs from GS1 in Sweden. Welcome.
You. Thank you. Hello, everyone. Do you know who GS1 and GS1 Sweden is? One. Good. That's almost always the case. I'm Lena Coulibaly, so I work at GS1, and I will shortly explain. So we are a global standardization organization. On a medicine package, you see a two-dimensional data matrix, a two-dimensional barcode, you can say. That's one of the standards within GS1. So it's a not-for-profit organization, a neutral, user-driven, which means that everyone that is working in its more than 2 million user companies around the world. So it's a secret, a GS1 organization, but you get connected to a GS1 organization more or less every day when you go shopping in a mall, or if you see anything that relates to a standardized way of doing business. And today I will talk about patient safety. So coming after Maria, you may ask, what am I supposed to talk about? So let's get started. And patient safety, patient empowerment. This is what I will talk about. And for 7 minutes, we work, in the whole world, healthcare for 2 decades. There is a lot of things going on, and the standards is about identification. So, for example, having the unique identifier on a product, so you know what it is. That's one part of the standards. To embed it in a QR code or a data matrix or an RFID tag or a regular barcode, to know what that specific product is. That's one part of the standard. And then how you share the information, the static information, the dynamic information, and so forth. That's another part of the standard. And this, as you see on the screen, on the medicine package, which a similar like this is on million package worldwide, and that's a GS1 data matrix, it's called, and it's embedded the unique identifier, the expire date, the batch, if there would be a recall, for example. That's kind of information that's in the supply chain. Now it's available for all of us, and that's thanks to that GS1 as the neutral standardization organization together with Google now have bring this so you can get the medical product information by just scanning the smartphone, and you actually saying mobile phone. So there you have the red thread from the two presentations. But now, so natively scanning the 2D, the GS1 data matrix, you get the information in your smartphone. And it's billions of smartphones that have this capacity, of course. So it's called Google Lens. So I do have a press release when you get those slides afterwards. But what about the empowerment and empowering patients? So just imagine what this unlocks. If you are about to take your medicine and you can directly check with your own mobile phone what it is. For example, you get the product name. So now I'm talking in very simple words, but there is a lot of more that you can explain about this. But just to get to know what it is, the expiry date, for example, those kind of words and kind of parts where you can have the traceability and you know what it is. That's for safety, and that's for the empowering. And it's also about sustainability and efficiency. Just thinking about this, for 2 decades, the healthcare sector has been digitalizing. So just the leaflets, instead of having it on paper, doing it in a digital way, just the amount of paper you don't need. So sustainability reasons and also efficiency. It's the global medicine transparency, so all the way, so you know what it is. Counterfeit is a very, very important part within healthcare and other sectors as well. And just having the same information it is in the supplier, in the supply chain, and the data comes directly from the manufacturer. So having both the supply chain with all the information from the manufacturer that also gets to all of us just using our mobile phone. So those kind of business benefits, if there was in a retail sector or in other sector, but here you talk, of course, about patient safety. And it's all about this, the open standards and the digital integration. So since it's in all the different healthcare systems and in the different traceability systems, where it's before this native way of scanning using your smartphone, it was more or less locked into those systems. And it was not designed to be accessed for public access, for all of us. So those barriers to get to the information that the manufacturers have provided, of course, this information. For example, as I said, the expiry date, the product name, and so forth, and bringing that to the hands of the patient and all of us. That's really something that we see is a breakthrough coming from a standardization world, but also to the benefit of all of us and all the patients. That's really about empowering patients. So that was my short, and there is a lot of things we do together with the healthcare sector, but I thought it's better to be a bit more specific. So if you have any questions, this is me and this is my LinkedIn, and thank you.
Wonderful. Thank you, Lena. So, you provided a couple of examples of where standards, are useful in traceability, for example. Verification was one. But what other ways, can standards make patients safer?
So there is a lot of different projects, and I thought to bring up one from Sweden. So in Sweden, there is this Swedish fracture register. And by using the different parts of the standards, the identification, the capturing with, for example, the GS1 data matrix, and then the sharing part, it's called the GDSN. So it's a synchronization where you share product information directly from the manufacturer to the hospitals. So there's been a pilot recently with the Swedish fracture registry together with GS1 to see if all the QR code, the data matrix barcodes scanned in a hospital, connected with this GDSN synchronization network that automatically populate the registry. So you get safer information, you connect the data that's behind the data matrix and the product information that's synchronized already in the product that's called GDSN. And that populates the registry and gets much more information and much more. You can do all kinds of wise decisions, so to say.
So there's less risk also for manual errors in those kinds of processes as well.
Yeah, and all the data. So what we talk a lot about in different sectors, because this is the GS1 standards is used in different sectors, and what's combined is that it's trusted information, trusted data. That's thanks to the open global standards that are used by so many different systems and companies.
Great, thank you very much. You'll
You're
come
welcome.
back in the panel in just a bit.
I promise.
Let's continue the journey. This time, Stéphane Boulanger, you are the policy officer of the European Patient Safety Forum. So the floor is yours.
Thank you, Thomas. Good afternoon, everyone. Thank you for the invitation. Just before diving into this topic of designing safe system across different care environments, just a few quick words about the foundation I work for. So the European Patient Safety Foundation is a non-profit organization. It's based in Brussels. And actually, I've been, all the day long, we've been hearing about how important it is to connect different perspectives and to have on board different stakeholders so that we can address, complex challenges. And patient safety challenges are really complex ones. So that's why our identity, our vision was to involve, as from the beginning, the different stakeholders. And we have on board actually insurance companies, national patient safety platforms, industry, healthcare professional association, scientific association, university hospitals, well, many different stakeholders, and it's not always easy, of course, to foster the dialogue between all those stakeholders, but that's our mission. And we try really to develop collaborative strategies and to develop tailor-made solutions for specific patient safety challenges. We have connections and affiliates in many different countries, even in Sweden, and no surprise, Focus Patient is one of our affiliates, and that's why I feel a bit at home. Why is it important to refocus on patient safety? We've been listening all day long about, many pressing issues facing the healthcare system. So why should we refocus on patient safety? And I could take here an approach based on figures and global ones, or even figures concerning Sweden. But I don't think that's the right way to market patient safety today, because it could give you the feeling that we are competing in terms of death linked to our different disciplines, and that's not the way I want to do it. I would prefer to say that patient safety over the last decades has demonstrated its ability actually to improve the quality of care. It's really a layer onto which you can build quality. You can improve things. And why is it so? Simply, maybe part of the answer is that 20 years ago, medical errors were still considered as human errors. And there was an important report named "To Err is Human," and it changed the perspective. It shifted the perspective to the systems, and saying that errors, medical errors, are to be seen as the result of weaknesses in the systems, and that we have to focus on those weaknesses to prevent harm, to prevent errors and harms. So that's the important contribution patient safety made. And it came along with tools such as incident report systems, such as never event approaches, the checklist, also surgery checklists, for example. And it could give the impression that patient safety is a matter of, it's an operational matter, it's a reactive matter, it's linked to clinical practice, whereas actually it's connected, as I said, to systems. And maybe that's something we have to improve in patient safety, is to shift or to balance, let's say, reactive approaches with proactive approaches, really targeting some specific risk we identify in the systems. Well, if we are to achieve this, we have to consider that patient safety is a strategic issue. And I won't be long here, but when it comes to staffing models, finances, organizational structures, everything has an impact of patient safety. And quite often, patient safety representatives are not there. But it's of dramatic importance for patient safety. So patient safety should be represented at the highest level of the management of different healthcare settings. And also, one argument for that is that patient safety actually could improve things. When you reduce the level of harm in your hospital, the personnel will feel safer, will feel more confident, committed, and actually they won't leave maybe the hospitals, and you are working actively on a workforce retention. So from the point of view of a healthcare manager, it's something important. So all of this are making the case for patient safety to be present at the strategic level. It doesn't work, whatever. I had the last slide for just 3 quick guiding principles, how to really, I can share about how we work at the foundation to improve patient safety and how we work with different stakeholders. So we try really to foster actions around priorities, because actually there are so many factors that influence patient safety in the systems that you could get lost. Actually, you don't even know where to start. So we had some kind of Delphi methodology with, together with our affiliates to decide where we would put our resources. And actually there are, okay, it has come. Those are the topics we are actively investing into. And I don't have time to develop all of them, but just to take the example of the well-being and safety of healthcare workers, we think it's really something important. Well, we are not to achieve any improvement of patient safety if we do not care for the healthcare professionals. So we have launched a collaborative campaign across Europe together with all our affiliates around the fatigue of the healthcare professionals. So what's the impact of the fatigue on the patient, but also on the healthcare professionals? We've yesterday we talked about mental issues. Okay, so what are the mental issues connected to fatigue for the healthcare professionals? How can we campaign around that? How can we improve things? We are also currently working on the development of a certification for second victim. Healthcare settings are implementing support program for second victim. I mean by that healthcare professionals who have been involved into an adverse event. So we are working now on the development of such a certification, and so on and so forth. But a last advice to improve patient safety across different care environment is really to not reinvent the wheel. There are many great things already done across Europe. So once you've set your priorities, once you know into which is the field you want to improve, please look at what others do and not copy-paste, but just get inspired and try to adapt it to your context, because you are going to save a lot of time. So that's what I wanted to say in a few words.
Thank you very much. I really like how you're framing it as a strategic issue. It's not just around the execution, it's really building the strategy on how to ensure that it's there from the start. So when you redesign healthcare systems and care pathways, what would you say is maybe the most frequent blind spot that sort of systems encounter as they are rebuilding? We heard in the beginning, moving, a patient clinic out to a shopping mall. So what would be the typical blind spot in your experience?
I think what's overlooked quite often is to give time to the healthcare professionals to get involved into the change, to get adapted, to be trained. The use of simulation, for example, is something that could help. To adapt also the pathway. You can have a first draft of your pathway, but you have to test it and adapt it. So that the healthcare professionals do feel that they haven't lost the essence of it, and that it embeds the vision they have of their work. That's something really important, I believe.
Very good. Thank you. We'll come back to discussion later. Thank you very much for your presentation. And Jolanta, we'll go to you now. Jolanta Belinska, founder and treasurer of the World Patient Alliance and the president of the Polish Patient Safety Organization. The floor is yours.
Good afternoon, ladies and gentlemen. I am very happy that Penila and Focus Patient invited me to this very important event. For me, patient safety is has a special meaning because I will need to tell you very briefly my story. So 20 years ago, I was a journalist and a regional newspaper, and somebody called me during my duty, told me many newborn children die in different hospitals in the region. I was very unknowledgeable journalist in this topic. Of course, I was involved in health issues, but not so much in Klebsiella pneumonia. So, in short, 17 children died in 1 month, and 35 were very, very ill. And it happens because the hospital just renovated a theater room, and it was dirty in the hospital. So it was a reason. But it was early 2002, and nobody cared about these issues, about the communication, about the safety. And then WHO announced after session at World Health Assembly, they decided safety is a priority for healthcare. It was 2005. So listen, the history is only 20 years, but in 20 years, like in my life, changed a lot, also changed in the meaning of safety. That time I was in front of the building in London with Minister of Health from Poland. I am from Poland, and this minister told me, oh, this safety is nothing, nobody will care about it. But the changes came, and now it is different safety, meaning not only in my country, but general in the whole world. And this safety, in former, in the 90s, if the patient was ill in the hospital, the doctor never communicated with him telling, oh, you have a serious illness, maybe you should, you have this solution. Nobody talked to the patients. With the family, with friends, and everybody has access to documentation. In these 20 years, it has changed, even in Asia, even in Africa. People have more awareness, people are more engaged, empowered to have rights to the safety on different arena. So now Stefan also mentioned 1 to 10 patients experience harm in healthcare. But as Maria told, care is moving from hospitals, moving to home, moving to community settings, to different places. What is the role of patient organization? This organization which I represent is biggest patient organization in the world. We have now, I think, 750 members. It is a lot. And what is unique to reach these patients and to give them things which other organization not give. So first of all, we like to work with many other organizations, because every member is valuable, and every disease and every region in the world is for us very good, because we can reach as much as possible patient groups, patient individuals. And we try as much as possible to reach these vulnerable populations, people with chronic conditions, rare diseases, with cancer, mental health, and senior people. What is the issue, how we communicate with people? We have a concept that via webinars, via conferences, we reach and give people knowledge. And this knowledge is on different fields. So if you check our webpage, World Patient Alliance, there are different movies for patients, about patient rights, about falsified medicine, about NCD, non-communicable diseases, communicable diseases, antimicrobial resistance. So every month we do things for the whole world. But as WHO divided the world to different regions, we also have some specific topic for Euro region, for EMRO region, for CEARO, and then we try to reach the expectation from patients and stakeholders, researchers from this region. Why this education is so important? You know that, for example, about self-care, there are many articles, many in social media, many things. But we try to give people the right information. So during this webinar, we invite researchers, we invite representatives from policymakers, from government, and I noticed, for example, we do about patient rights in Europe. We had a webinar, but people around the world joined to this webinar, and there is always more than 1,000 audience online. So I think this is a right direction. Of course, face-to-face meeting, like even here, when we can discuss during the break, I love it. And that's why we do every second year a big conference and also regional meetings, because then we meet like here, the representatives of the organization. And you know, it was same with Penila. I met her on one meeting. She met Alex from Portugal on our Euro meeting, or I met Stefan. And then we have the network. And I think we can reach the goal. So give the safety, make the system better, because we also have the power to ask governments, to ask policymakers to make changes. If somebody is alone, or only organization on one level cannot reach such, have not an impact like a big organization. We can cooperate, and also during World Health Assembly organize different side events, and force what we want, what our patients want to be more safe. Every day I work in the hospital, and I tell you one example. There are some senior patients, they take a day 30 tablets. They come to the hospital with 30 different tablets, and they know exactly what to take in the morning, what in the afternoon, what in the evening. And this medical reconciliation, so reducing amount of medicine to 5-7, which is acceptable and without wrong interaction, it could be only in hospital. And these patients doesn't have knowledge how they damage their health. So as patient organization, we have some also trainings for patients, how to what they should know about taking a medicine, not to order in Asia painkillers or this even small things, but we elaborate this. Okay, so it's time for us. It's very important to empower patients on every level, that they are more not aggressive, but they have a good communication with medical staff, that they appreciate also this staff. Our campaign for the last 2 years is in our heart is in heart of health system are nurses. So we do this campaign for nurses. How important is the role in the health system of every nurse, because we know we all know how shortage is with this issue. Okay, I know my time is over.
Coming to an end, so yeah, it would be great if you could round off in the next minute.
Yeah. Yeah?
You done?
Yes.
Okay, well, wonderful. Thank you. Jolanta, it's great, maybe we can leave, this slide on a little bit as well, because there were some really interesting points. And I wanted to come back to a question that I was thinking about in your presentation when you talked about, the examples that you had. Where in healthcare are patients, not feeling safe? What's the area where they are most worried or most concerned or most do not feel safe in your experience?
Everyone was a patient. So even when we enter outpatient clinic, hospital, we feel unsafe because nobody healthy is coming to the hospital. So this fear is from very beginning. But I think the most crucial point is before surgery, because there is, everybody knows the doctor should explain and it should be a perfect communication, what they want to do, how they want to guide a patient through the surgery. We have this WHO safe hospital, safe care, so the method that's everything should be planned point after point. But in reality, even in my hospital, it is sometimes this communication is wrong, and the patient feels so unsafe before the operating room, because they don't know if laparoscopy or maybe another type of surgery would be better, so they feel, I think, in this moment very unsafe. When they wake up, it's better. Then we can start. Yeah.
Thank you. So welcome up, panelists. Please take a seat, and we can, go back to the neutral slide in the background here, so we don't get all the light. There was one point in the presentation that was really interesting, and that was around creating the systems, designing systems for patient safety, which also means, the speaking up culture. And Stefan, you mentioned it. It went from a, human error to a system error. So how are we doing on the speak up culture when it comes to patient safety to prevent issues or build systems that are solid? Who wants to start there?
Oh, I can start. You are right that usually, I tell you again from the praxis, if something went wrong, nurses, doctors, they share this information with the boss of the department, they share this information with colleagues, but it is very difficult to share this information with the patient and with his family. And I think this is this culture that we don't want to, in open, to say, oh, maybe something went wrong because it was Saturday and we had not MRI open in the hospital, or we gave the chance to make an operation to a doctor and something went not what we expected during the operation. They decided, I tell you one example from the last week, the professor, very famous professor, removed all gynecological organ to the woman, 24 years woman, not waiting for histopathology, which arrived to the theater room in 20 minutes. So he did it after 10 minutes.
Yeah.
He didn't wait this 10 minutes, and she would never have children. She was feeling very, very lost. And his explanation was, oh, I was thinking, I was seeing that probably it is a very damaging change in her uteral, and that's why I removed everything. You know. So I think we should build this culture that things can happen, and we should share it very honestly, because only nobody who is doing nothing has no errors. Yeah, but.
And what do you say about speaking up culture? Stefan, you wanted to add something as well.
Yeah, sure, because I think that it's really important to empower patients to speak up, and at the same time, you have to make the institution ready. You have to make professionals ready to hear what is being said, because it's even worse when someone speaks up and then nothing happens. I have in mind an example in Norway, the Akademiska Hospital. They implemented a patient checklist. So the idea is that instead of the healthcare professional running a checklist, well, they do have their own checklist, but the patient is checking actually. He's ticking the boxes about his own preparation and if everything runs smoothly. And if something doesn't run smoothly, he has to speak up. But of course, everything has been prepared, and the professionals, they know they are not defending themselves. They know it can happen. That's the role of the patient to speak up, and that's the role to listen and to adapt and to correct things. And I think that's the way we should look at it as a system. The patient has a part to play. The institution has to get the things ready for the healthcare professionals.
Absolutely. So we've heard two examples, from abroad in a way. What's the situation in Sweden? Speaking up culture.
I think the speaking up culture is rather widely among patients, but I also think that we have to create a working environment for our healthcare professionals allowing them to speak up. And there, I think the leadership in the healthcare section is very important, and to be good examples for their co-workers, and actually showing this is okay. You are allowed to say if you've done something wrong, and if you think this isn't patient safe to do it in this or that way. So I think it's very important to create this environment.
And if you see something, you know, which could pose a risk to the patient and things like that, and you know, I kind of like the approach of having technology and standards, as we're talking about before as well. You need that strong backbone, but then obviously one of the weak links is in the execution of that, and whether then, you know, everything gets reported or gets funneled or acted upon, because there are staff turnovers, there is a, you know, immense need for training as well of healthcare providers and in the whole system to make sure that, you know, there's no weak links left in a way. Any other thoughts and reflections on each other's talk? Yeah, please go ahead.
No, so talk about from my perspective, from the standardization perspective, to be able to speak up. So you have the infrastructure. So you have who is the right patient, who is the right caregiver, what's the right. So having all those different rights, so you know, so you really can do those wise decisions. So that's from the standardization. You might think it's a boring place to work at in a standardization, but it's actually not, because we are really, you can talk about everything and we can relate to from that angle. So there is the infrastructure to be able to speak up. I think that's an important part.
Absolutely. No, and there was a lot of mentioning also around the empowerment of patients along this journey, and I'm sort of wondering, you know, the patient and empowering a patient and patient safety. So are we then adding on an additional burden on the patient because we're suddenly also placing the patient safety question in their lap to monitor devices or you know, administer their own medicines, etc. So are we sort of shifting the burden of patient safety from the systems and healthcare to the patients? Is that a risk? Stefan, you were. I saw that. Go ahead.
Okay. Okay then. Well, I didn't see that.
You wanted to say something there.
I'm not sure we are really pushing it on the patient, but I would say that we have a bigger concern for the relatives, for the family, for the informal caregivers, because they are the ones who are going to feel responsible. And they have, you know, to be there all day long, and they can be affected by guilt, by fatigue again, like a healthcare professional.
Yeah.
And so we should consider them as healthcare professionals, and we should take care of them as well. And of course, the patient is important, but everything that will happen at home will depend highly on the close environment.
And how do you build that into the system?
Well, that's a good question. I think that you have to involve them again, because you have to hear about their concerns, about their needs, and to adapt. You can't just design new pathways saying, oh, we are going to ask them to do that. Are they ready to do that? Do they have the time? Do they have the skills? Do they, you know?
Do they have the
are they
information?
trained?
Yes.
What happens in term? Well, in case something wrong happens, what after if something wrong happens? How are they being followed? Well, many questions.
Yeah. Jolanta.
For me, this empowerment is very, very crucial, because, you know, when patient is empowered, he is responsible, he is involved in the treatment, he knows what to do in the system. So that's why this empowerment is also for us crucial to give patients the knowledge, because if patient is not knowledgeable, he doesn't know the background. When somebody from healthcare speaks to the patient in a language they don't understand, like Holter taking or do MRI, you know, for some people it is extra language, so they don't understand. So I think empowerment is when the patient is knowledgeable, when they can understand what is going on during the treatment, when he can ask a right question and receive the answer for this question. So this gives the involvement in the treatment, and it gives empowerment.
Maria, I had a question for you because you've been redesigning a patient care pathway, recently, and you sit with a lot of experience. I was just wondering, if you were to do the whole journey all over again, what's the one thing that you would do differently next time?
That was a tricky one. This sounds very bad, but I'm not sure that I would do anything differently, actually, because I think that what we did right was something that you talked about. We involved the healthcare personnel from the beginning. We took it in small steps, because if I've said in 2020, hey, let's open a treatment clinic in the shopping mall, I think they have locked me up. But we did it, we actually involved the patient organizations, we performed an evaluation among our patients, asking them when and where would they like their treatments, if possible. And we involved the staff, so because when we asked the staff from the beginning, do you think that the patients would like to receive treatments in any other places than the hospital? No. They're very happy here with us at the hospital. And of course, the patients were very happy. But the evaluation and the questionnaires actually show that, if possible, many patients would like to have their treatments closer to home. And so then we tried. We didn't go from there to the clinic. We tried a small mobile unit parked outside the hospital. So I think we gradually moved forward, and we involved the staff all the time. They were the ones that actually, together with the patient representatives, talked about, okay, patient safety, how do we do this? Is this or that regime possible to move out? So they were involved all the way. So sorry, being
I like
cocky,
that. No,
but
I think a well thought through process, having
I think,
all the stakeholders involved and engaged. What more can you wish for in terms of setting up a solid system? I think that's where, unfortunately, our time is out for this panel. I had so many questions still that I would have wanted to discuss with you, but that will be for another time. I would like to thank all of you for participating with your expertise today in the panel. I'd like to thank you for listening and give you a big hand. Thank you.